Hip dislocation, causes and symptoms. Hip dislocations occur when the femur slips out of place in the hip socket. Great force typically causes this injury, but it can result from an innocent activity such as tying a shoe if a person has had hip replacement surgery. A hip dislocation is a medical emergency because it can affect a person's blood flow and nerve communication. Without prompt emergency treatment, it can cause permanent complications. This video will cover hip dislocation, including possible causes and symptoms. Causes. A 2020 study suggests that motor vehicle accidents are the most common cause of hip dislocations. The injury usually requires significant force, which can also occur due to a high fall, such as from a ladder or window. Because of the force required to cause a hip dislocation, a person often has another significant injury, such as a fracture. A person who has had a hip replacement is more likely to experience hip dislocation. Some of the causes that may contribute to this include attempting to stand after sitting on a short or low to the ground chair, bending down at the waist, crossing the legs either in a sitting or standing position, sleeping on the side. According to an article in the Bone and Joint Journal, a hip replacement is most likely to dislocate within 1 month after hip replacement surgery. An estimated 90% of the time, a person will dislocate their hip posteriorly. The hip is a ball and socket joint where the ball head of the femur or top bone of the leg connects into the acetabulum, the socket where the femur fits. When the hip displaces posteriorly, the ball of the femur moves toward the buttocks. When the hip displaces anteriorly, the ball of the femur moves toward the front of the body. Risk factors. Young adult males are most likely to experience an accident-related hip dislocation. As motor vehicle accidents are a common cause of hip dislocations, people should take precautions such as wearing a seat belt. Having a hip replacement can also increase the risk a person will experience a hip dislocation. Symptoms. Hip dislocations are very painful when they occur, as well as hip pain. A person may experience inability to move the leg, a leg that appears to turn inward or outward, a leg that seems to be slightly shorter than the other, problems moving the leg, loss of sensation in the foot or ankle. If a person thinks they may have dislocated their hip, they should seek emergency medical treatment. Diagnosis. Often, a doctor can identify a hip dislocation by physically examining the leg. However, a doctor will usually order imaging studies to determine if there are other fractures or injuries they cannot identify with a physical exam. Examples of imaging studies including a CT scan. Prevention. Often, hip dislocations occur as a result of accidents. Practicing safety techniques such as wearing a seat belt in the car and using ladders safely can help. A person who has had a hip replacement or undergone other surgical procedures to correct traumatic fractures should follow a doctor's orders about how much activity they can do post-surgery. This can reduce the likelihood a person's hip will dislocate. Hip dislocation can be extremely painful, and it is essential to seek emergency treatment and follow a doctor's advice to enhance recovery and prevent long-term complications.